we have a big increase on our numbers when it comes to saddle PE. We used to maybe get one every couple of months. Now we're getting a couple every week.
Wow. Philip, have they noticed a difference in the consistency of the clot itself? That it's less, it's not as friable as a traditional clot. Does it have the elasticity of the things that we've seen with the embalmers? Washing off to a white consistency. Those
That's a
kind
good.
of things.
So recently, just only last week, we pulled out one of these clots, and I tried with all my force in front of the room. Everyone was kind of looking. I tried with a good amount of force to pull it apart, and I could not.
Okay. Yeah. So here's another.
I think as well, from experience from the cath lab, have you seen anything like this before?
No, sir.
Was there a point at which you started to notice this? Because it's typically, I would say, unusual.
As we go back on the pictures, we thought it was something that was just a fluke, something that just would go away. So no one really paid too much attention to it. This was in 2021. In 2022, as we started to increase on our numbers, we then started to question at that point the changes, the pathology. Even, like I said, these vascular surgeons are in the field for 30, 40 years. And for them to look across the room and look at the clot that they just pulled out and to ask the room, what is that? We started then to notice there was something wrong.
Wow. Would explain this one here.
This is also vena cava. It is a patient who presents also with a aneurysm, as you can see it drawn out there to the left, and then clot above that.
Okay, so the aneurysm is here.
Yes, and then that left side that kind of breaks off to the left, that is going into the kidney, the left kidney.
Okay. Yeah. Okay. So this one here, left kidney, and then this is going down the vena cava.
That's correct.
Wow. Yeah. So I'm just stepping through some of the images here, Shankar, and getting some context. Any kind of link to a patient has been removed so that we can just objectively look at the images, because these are real images, and try and make sense of them. So here's another one that you've got here.
Yes, this is also right leg. Actually, no, I take that back. This is also PE. This is the right lobe, and those are the blood clots. And then to the left there is the actual device, that tube-looking thing that goes up into the lung, the right lung, is a suction device, somewhat like a vacuum that we then suck the clot out to save their life.
Yeah, and these clots here, so we can see what look like grape jelly, the typical grape jelly. Would this have had the abnormal consistency as well in these whitish parts?
Yes, you can see the change, the transition there. You see the jelly clot on the, that lower part there. That's what we always seen. But as it changes, as it turns white, that's where you got those fibers like material that is now embedded in the clot.
Yeah, I find it very concerning, Shankar, that this is occurring ante-mortem. And how can we not be seeing it on angiograms, general routine angiograms? Because angiograms are done all the time. Any thoughts?
Philip, I'm not sure how that works, because the angiogram should pick it up easily. It's an obstruction to flow.
Well, what I mean is that maybe we're seeing them earlier.
I think Dr. Shetty was right when he said it is a casting. So on angiogram, it's somewhat easy to only see a possible narrowing as the contrast still material is running on the inner. So I believe that the fibers can be mistaken for the actual material, just like a vessel wall.
Yes, because it's smooth. So when you look at the white fibrous thing, it's smooth on the inside. So it almost lays along the artery
Yes.
as, yeah, you're quite right, as you said, Shankar, as a cast. So I'm trying to think about what would cause it to do that. I just can't think of a replica disease.
Yeah, you got a couple of things at play, Philip. You got the endothelial damage. So depending on where that occurs, where the offense occurs in the vasculature, that combined with this technology that's around creates a reaction. And so that might be the reason we're seeing it in such diverse areas. I'd wonder whether the same patient would have it in different areas, or whether each patient develops it in a unique area depending on the type of administration of the vaccine.
I guess the thing that
Might be
I'm
a
trying,
bolus effect.
yeah, the thing I'm trying to work out, Shankar. So if you imagine, we have this in plaque disease. So where you have the endothelial damage, you then have the plaque deposited. But if this is more like a cast, it seems to then grow and extend down the blood vessel, which a plaque doesn't really do. It tends to concentrate where the damage is. And so this is very, very unusual. And I can't think of a replica disease where we would see anything like this. So this is where you have to then step back and say, is this about the technology rather than anything else?